Good evening. Good evening. Good evening, and welcome to Let's Talk Life. This is Pastor Chiquita Ashford Williams. Amen. Thank you for being so patient with me on tonight. I clicked myself in and clicked myself out. Sometimes with technological advances, you go to moving too quick, and there it is. We're here tonight. We're here tonight for um, the continuation of our guest speaker and our public health awareness from Miss Brandi Roberts. For those of you who joined on last night, I hope that you tagged and shared and allow some other people to come in. On tonight, it's going to be in the form of Let's Talk Life. We're going to talk life, and we're bringing Miss Brandi back so that she can answer any questions that you may have regarding the presentation or anything that's regarding to public health awareness and all of the STIs that she has carefully explained to us. And before we get started, I just want to say my condolences to the McRae family. My prayers and condolences to them. And I know for many who are sad because of DMX, and his family. He was a great actor and singer. We're all going to miss him, but condolences to him and his family. So, for those of you who have joined on, please take the opportunity to tag and share. Good evening, Miss Brandi. Thank you once again for joining me here on tonight. And I'm just going to share when you're talking. When you're talking, I have to mute so it doesn't. It gets kind of scraggly. So when you're talking, I'll mute, and then if I'm talking, you'll go ahead and mute. That'll make the people who are listening hear us a whole lot better. So for those um, who did not join us on yesterday, I'm going to go ahead and I'm going to introduce Miss Brandi again. I'm going to introduce Miss Brandi again. Miss Brandi, I know her to be born of. She's a Florida native, to be born of Miss Tina Passmore and Mr. Freddie Roberts, and she had four siblings. Miss Brandi, she earned a Bachelor of Science in Health Education from the University of Florida. She's a Florida Gator young lady, amen. And after completion of her undergraduate studies, Brandi accepted the Public Health Associate Program Fellowship with the Centers for Disease Control and Prevention in the focus areas of HIV and STD prevention and emergency preparedness. She continued to further her knowledge and academics into earning a Master's of Public Health professional degree from the University of Arkansas for medical sciences. She is affiliated with various civic and professional organizations such as the Arkansas Society of Public Health Education, Public Health Associate Program, Alumni Association, current president of the Arkansas Public Health Association, and is a board member of the National Coalition of STD Directors. Brandy's current role is the STD Prevention Program Manager for the Arkansas Health Department. So I'm going to give you just a few minutes because I know I came on at first and then it went off. So to make sure that everyone has been able to join on as well as tag any other persons that you would like to hear this program. So I do want to say um, hello to my Facebook Live friends. Hello, Miss Audrey Mitchell. Good to see you, woman of God. Miss Dorothy Henderson Robinson, how are you? Hey, Miss Beth. Hey, Miss Tina. Thank you so much for joining, ladies. We're here, and Miss Brandi is going to be asking. She's going to be answering questions. So what we're going to do now, I'm going to turn it over to Miss Brandi so she can give just a brief overview of what she does and what she talked about on last night for those of you who were not here. Now, if you have any questions or comments, please type them down in Facebook Live comments. I can see them. I have a couple of devices going here. We have to do it like that. And Brandi and I, of course, can communicate through our chat on Zoom. But if you have any questions, please put them down in the comments. If you would like for that question to be anonymous, then please put that question in my Facebook Messenger or Brandy's Facebook Messenger, and either one of us will get that question and we will answer that question for you. So I do want to say, hey, Miss Lisa, thank you for joining. So I do want to say that I have some anonymous questions that have already been sent to me earlier today and on last night. So if there's some questions that you want that you want to remain anonymous, by all means, put them in my Facebook Messenger, and I'll get those questions. I have a couple of devices going that I can go ahead and get with those questions for you and relay those questions. I will say this before I turn it over to Brandi, that we're living in a time and a dispensation that this is something that highly affects our community. And not only does it affect our community, but it affects our children. And so, whether we want to deal with it or not, one of the greatest things that we can do, Brandy is very passionate about what she does, and I'm very passionate on the other end of helping the total family. You see, we can't fix one part of the family. We're not trying to help other components of the family in order for people to have a happy and a healthy and a whole. There is a time that we need Jesus, but we also need to be able to deal with some of these outside stimuli that is affecting our family, affecting our children, and it's affecting our livelihood. That's even leading up to death itself. Now, you can we can some of us, we're going to die, each and every one of us can, we're going to die, we have an appointed time to die, but some of us are going to go much quicker because of ignorance and a lack of knowledge of taking care of yourself and what to do in situations like these. Okay, so Brandy, I'm going to turn it over to you now and let you introduce yourself, and we'll go from there.
Sure. Thank you, Ms. Chiquita. Good evening, everyone. I'm glad to be here again to be able to answer any questions that you have. So no questions are silly questions. I answer these questions all the time. If you don't know, you just don't know. So this will be your opportunity to ask any questions that you have. And if I can't answer it, I'll tell you that. I'll be honest with you because I don't know everything. I told you I'm not a medical professional, but I will get that answer to you. So last night I had the opportunity to go over STIs, the reportable STIs that we have, how this impacts our community, the way that it impacts our community, what we can do, and also talked about some of the different signs and symptoms that you can have for your STIs and the available treatment. We talked about the ones that are curable, the ones that are not curable, and things that you can do to prevent yourself from catching an STI. Pretty much wrapping up, using protection, not having sex, if that's the case. And also with the HPV, there are some vaccines, a vaccine that's available to prevent individuals from getting certain strands of HPV because it is very common. So as I mentioned, not you can like I say, shoot me a message on Facebook, and I'll be more than welcome or happy to answer any questions that you have tonight, no matter how they are, no matter how crazy you think they are, or if you don't know, or because I bet you, I kid you not, it's somebody else that want to know that same answer to this question as well. So definitely please ask any question that you have.
Okay, Miss Brandy. Hello, Ambassador Graham, woman of God. It is good to see you. Thank you for being here. So, Brandy, once again, for all of you who may have a question, please put the question in the comments on Facebook Live. If you would like that question to be anonymous, then please put it into my Facebook Messenger. I have a couple of devices going, and I'll get that question for you. So I have some questions here that were anonymous that I'm going to go ahead and start with that. But don't let that stop you from putting in questions in the comments that you may have. Listen, don't miss this opportunity. Don't miss this opportunity. This is a time to where we learn, we grow, and we ask questions so that we can be better women. We can be better men. We can be better wives of what to expect when things like this happen. I can assure you that trouble does not discriminate. That tomorrow may be somebody else's day, but today may be your day. So trouble does not discriminate. And when trouble knocks on your door, I want you to be well prepared to know what to do. So one of the questions, Brandy, is um, if you are aware that someone have an STI, is it legal to share that information with an individual? Like if you know you have an STI and the person here asks me if it's like molestation or rape, you know you have an STI and you sleep with somebody willingly and you don't share that information, is that legal or not legal?
Right. Good question. Unfortunately, individuals are not held by HIPAA, which is the Privacy Act that a lot of federal agencies have to go by as far as releasing of public information. So they can tell anybody they want, if you have something, and if you disclose that information to that particular person. Okay, so yeah, that unfortunately, if somebody find out and they spread the information about you, they can. Now, there are some laws against like slander and things of that sort, which I haven't seen anybody go that far to do that. But, there is like, some different laws about like slander of your name and things of that sort. But as far as like, somebody saying that you have something and spreading the information, even information that you told them in confidence, there's nothing, that you can do about that. Now, as far as HIV criminalization goes, just wanted to touch on that. So I'm not familiar with the laws in Florida, but I can speak about the ones here in Arkansas. And a lot of the laws, they are working to change them in different states. So I would have to look up, different laws in different states, because I know we may have people in different states and it just depends on where you're at. But here in Arkansas, it is a misdemeanor to have sex with somebody and not inform them that you're HIV positive. When you're HIV positive, you have to inform your physician, you have to inform your dentist and other medical providers of your status, and you also have to inform your partner. Now, I know a lot of states are moving against that, moving from that because, of PrEP and because of those different medications, and then, using protection and also they go by the intention of if you're trying to expose that person, and so just to kind of talk about the difference in that, so if you're using protection, if you're on medications and things of that sort, you're not intentionally trying to infect somebody with HIV. Now, those laws are beneficial because you do have people that intentionally are around here trying to expose people to HIV. I know y'all seen some of those videos where people get on there and say, oh, I'm mad at the world. I'm mad that somebody gave me HIV. Now I'm finna go get revenge on these individuals and I'm finna spread it to everybody. That's who those laws are for, because you do have people that intentionally go out and try to expose people to HIV. So it just depends on your state. Some states, it's felonies. I know even here in Arkansas, you have to register as a sex offender, which I think is a bit much, especially if you haven't committed like any type of molestation charges, you only have HIV. But yeah, that law is going to be dependent on your state, and it's only for HIV. It's not going to be applied to any of your other STIs. So syphilis, gonorrhea, chlamydia, pretty much, that's why you have public health awareness, because, it's consensual. Sex is consensual. I mean, that is the choice that you're making. Now, I'm not talking about, molestation where you got raped or something like that. I'm talking about consensual sex. You chose to, lay down, have sex with this person. It is your responsibility to make sure that you're protecting yourself. You shouldn't depend on somebody to tell you, oh, I got HIV. Okay, we have a lot of people that, that'll call me and they're just so upset. Well, they didn't tell me, they had HIV or things of that sort. Why do you want to depend on somebody, especially somebody that you don't really know like that, to tell you that they got something? you should be trying to protect yourself. And then the other thing, what if that person don't even know they have HIV? Okay, so you should be protecting yourself at all costs to make sure, that, you're wrapping up and that you're protecting yourself, because at the end of the day, you're the one going to have to deal with that. They can go get a misdemeanor, and go to jail in some cases, or have to register as a sex offender. But at the end of the day, you're the one going to have to sit up there and live with those long-term consequences of, the STI, HIV, or things of that sort. I know that was a long drawn out answer, but I just wanted to make sure that I touched on that, because I know, we have that happen all the time, where, individuals, they'll find out somebody have HIV and it's like, oh, boy over there sick and all this other stuff. And again, like I said yesterday, you don't need to be worried about the ones that know they have HIV, because they're on medications. They know that they have it, so they know they try to protect, others from having it. It's the ones that don't know that you should be worried about, because the thing is, if they're not on any type of medication, their viral load is high, their immune system is, CD4 count is low, and they're actually, can readily transmit the virus more because they're not on any type of medication. So again, they teach you in some medical offices, universal precautions. So treat everybody so you think about everybody got an STI, and just, do the protection that you would in the event, if you knew somebody, because, you wouldn't even have sex with that person if you knew they had something, or you will use protection. So just take it as though everybody has an STI, and make sure that you, conduct yourself accordingly.
Okay, Brandi, that was great. I have a question here in the comments. I want to respond to this as well. I see Miss Tabitha. How you doing, Miss Tabitha? I see she says she put a comment down there. Practice celibacy. I want to put this out there. I mean, Tabitha. I mean that's a really good thing. I mean, I'm there myself, but the reality is everybody is not practicing abstinence or celibacy. If everybody was practicing abstinence or celibacy, then we would have the high numbers. Like Randy said, we're not going to talk about the statistics, because the statistics can be biased depending where you take the statistics at. But what we know is for real is that people are contracting STIs, they're contracting HIV, and we're passing it amongst other people. So there's a level of ignorance there, and there's a stigma there that we have to eradicate in order for us to face the reality. So I just want to say, that's very good. I wish that everybody would, but everybody's not going to practice abstinence and celibacy. That's just my comment. On here on Friday nights, I come from a different perspective. Here we are coming from a different perspective. It might not be your end all, your be all, or what you want to hear, but we come from a different perspective when we are addressing questions and things. And so Lisa says, Brandy, how do you recommend? Who do you recommend to start the prep? Um,
Yeah, sure. And for PrEP, so as I mentioned last night, it is pre-exposure prophylaxis. So this is a medication. It's actually an HIV medication that you take that prevents you from contracting HIV. So as far as recommendation for taking PrEP, so I did list, some of individuals that we consider as higher risk for STIs. So, individuals that, have multiple partners, that are at increased risk of getting HIV because they share needles, are at risk of getting HIV because they have multiple partners. So pretty much, if you think you're at risk of contracting HIV, you should consider getting on PrEP. So it is, like I said, it's not available for everybody, because there are some certain medical criteria that you have to have in order to be able to take the medication. Like you can't have any type of liver problems, because of course, with medications and things of that sort. But yeah, it's available for anybody. So if you feel like that's something that you need, you're more than welcome to actually get on PrEP. So like I said, I don't want to, put a criteria, because like I told you, everybody who has sex is, at risk for getting HIV. Okay, so yeah, it's available for anybody to take.
Great, great answer. Y'all doing okay out there? I see you, Tabitha. Yeah, it took you a long time to get there. That's all I'm saying. Everybody's not there yet. And until they get there, then we have to coach people along the way to take care of themselves. Don't depend on someone else to take care of your health status. You take care, you make choices and decisions to take care of yourself. So everybody's not there. Listen, abstinence celibacy, that's awesome. But everybody's not there yet. We can tell everybody is not there yet because we continue to have babies born and we continue to see some other things that are transpiring that we know everybody is not practicing abstinence and celibacy. Um,
And listen, and Ms. Jakita, I want to add to that. So, I know we're on here talking about, the negative aspects of, and consequences of sex. But let's just all be real here. Sex is a great thing, and, we don't want to just tell people, oh, sex is just so bad and all this other stuff, because as we know, sex is pleasurable. We already know what sex was made for, so you can procreate and things of that sort. So not at all are we saying, don't have sex at all, don't enjoy your life and things of that sort, but the thing is, just be prepared, for some of the consequences and just make sure that you're protecting yourself. So you don't got to be celibate. Yeah, that's going to be your 100% chance of not getting an STI. However, also 100% chance of not getting the STI is if you're with somebody, you're in a monogamous relationship, they don't have an STI, you won't get an STI as well. Because like I said last night, it takes 3 to get an STD. Okay. So I just wanted to clear that up because I know people always, oh, I'm going to be celibate and all this other stuff. You ain't got to do all that. Like I said, we ain't stopping nobody from doing anything, just protect yourself.
That's awesome, Brandy. Thank you so much. That's awesome. I mean, that's all we're trying to do is we just want people to be aware of your consequences. In everything in every aspect of life, there are some consequences that comes with your choices, and we're just trying to show you the consequences. I know people are shutting down. People are saying, "I don't want to hear that." And I can recall some time when I was going through some things like this in my life, one of the reasons that I didn't want to hear it because I was ignorant and I didn't know any better. And so I've learned that if you want to grow and you want to know more, sometimes it's going to make you feel uncomfortable. And so if you're growing in life, if you're evolving in life, get used to being uncomfortable because that's going to be part of your growth is being uncomfortable. So Brandy, I have another question here, and it says that if you test positive for STI and you receive treatment, and you refrain from relations with that person, is it safe to say that you are clear from that STI?
All right. So the recommended time, and a doctor should explain this to you when you're taking the medication. But for like gonorrhea and chlamydia, the recommended time frame that we tell people to wait after they finish all of their medication. So that's the most important thing because y'all know people get antibiotics and don't like to finish all of it. So make sure that you finish all your medication, and it's recommended that you wait at least 14 days before you have sex again, just to make sure that your body has cleared it. It actually cleared up earlier than that, but just to be on the safe side, you should wait at least 2 weeks before you engage in any type of sexual activity. And also the most important thing is make sure that you get your partner treated as well. I believe it or not, and you wouldn't believe, some people, they'll go get treated for the STI and then their partner don't go get treated, or, they cut buddy or whoever, and then they end up going to have sex with that person, and then they end up getting re-exposed again. Again, I can only speak for Arkansas, but here what we have is called expedited partner therapy. So basically, when you go to the health department, you test positive for gonorrhea and chlamydia, and of course, you don't meet any other risk factors that increase your risk of HIV. We have it where they'll actually give you pill packets to give your partners. Okay. And like I say, I don't know if they do it in Florida, and I know some other states have it as well. I know in Georgia they don't do it, and I know Kansas and states like that, but most of the states are trying to get that on where you'll be able to get that medication and give it to your partners. Because again, reinfection rate, some people don't want to come. Y'all know these guys don't like to go to the hospital, don't be want to sit in there all day, so you can give them that medication. So to answer your question, it's recommended 2 weeks after you take all your medication, like I say, because like I say, you won't believe some people don't take all of their antibiotics, once they stop having those symptoms, once they stop burning, once they start having that discharge, they'll want to stop taking it. But you want to make sure that you take it completely so that it can clear up the infection.
That's a good one right there, Brandy. I see down here in the comment, and I know you took care of this on last night. I guess Tabitha is asking the STI versus an STD, and Brandy kind of basically did the same. STI, STD, they're basically the same. So if you're having a question, what's the difference between an STI and an STD? Brandy did cover that in her PowerPoint presentation on last night. That they're basically the same. Um,
Mm.
so I have another question here, and it says that, and this is just what they said to me. They say no question is a bad question, but they say, is it possible when you're being sexually active? Does it matter if it's 1 minute or a 30-minute time limit that you can get an STI? Is there any type of time limit? After entering into intercourse to contract the STI.
That's actually a good question. I have never gotten that question before. That's actually a good question. I done got some of the craziest questions, but I never gotten that question. But that is a really good question. So I have not read anything about the amount of time that it takes to get in an STI. To STI, it just depends on where it enters your body. I do know that it is easier for a man to give a woman an STI than a woman to give a man an STI. Because just think about that whole anatomy, because the semen is actually going inside the woman, it's a little bit easier. And then with the man, a woman, those secretions would have to go inside, their penis or whatever. So there's no time limit. So don't just think, I can just take the condom off for a minute, and then, put the head in a little bit, and that, I'm not at risk. You're going to be at risk the entire time. So don't look at it as, oh, I'm just going to do it for 5 minutes and I might not get anything. You might not, but you might do. So I won't take no chances on it. Because people do. But that's a really good question. Kudos to whoever asked that question. I'm gonna have to use that one. Is it a time limit? But yeah, it ain't no time limit. Like I say, that's not a question that I typically ask people, is how long or how long he stuck the head in before, you got it or whatever. So it's no time. And I don't even know any studies on like the amount of time that it takes. Like I say, it's just gonna depend on when those bodily fluids actually went inside, or it got exposed to like that open area that you actually can get the infection.
Thanks, Brandy. That was good. I just want to reiterate for maybe those who have come on that are watching by Facebook Live. If you have any questions, please put them in the comments. These are questions that were sent to me anonymously, and of course, I asked Brandy off the record any type questions that that I have. But if you have any questions, please don't allow Brandy to leave this platform without you asking those questions. Now, once again, if you would like for the questions to be anonymous, you can put it in my Facebook Messenger and I'll receive it because I have a couple of devices going on. And so we're just trying to get answers. I don't know, but I haven't always made the correct choices in my life. I'm not sitting here, conducting a seminar because I've always made the right choices. I can tell you that the reason why I'm here is because I made a lot of poor choices. And I can remember, in my younger years, playing Russian roulette with my life. That's what I called it. Playing Russian roulette with your life, because there are some times that you knew that you was in an unsafe environment. You knew that a person was doing certain things and had certain things, and you still continued to do that. Now, nobody wants to talk about that. Maybe that's not your testimony, but I like to be transparent with people. I found myself playing Russian roulette with my life at one point in time. But now that I know better, I do better. And so I'm only trying to bring to some, because see, some people are not going to say how they really feel and what they have experienced. So I'll be that one for you. I'm okay with that. I don't sit with an umbrella of embarrassment. I believe in being in transparent, because I know that somebody else has gone through that as well. Um, so the next question is if you find out that you had an STI, but you were forced to have sexual relations with two persons, you were forced to have sexual relations with two persons at one time. Um, the question is, how do you find out who did it come from? If you were in a forced situation, you really don't know who it came from, but there were two persons involved. Um,
All right, and I'm gonna be very blunt when I answer this question. Why does it matter who it came from? Okay, the thing is, you need to be treated for the STI. It doesn't matter who it came from, and if for treatment purposes, the antibiotics is not going to hurt them. So actually at most health departments, they're going to preventatively treat individuals anyway. So if you've been exposed to somebody, or if, say for instance, I come in, I say I have chlamydia, I test positive for chlamydia, they're going to preventatively treat you anyway or give you medication anyway. So it really don't matter who gave it to you. The main thing is that, you want to get treated for that STI. And again, you want to also inform those individuals that and again, I know somebody asked that question earlier, what if somebody, about, somebody telling your business, but, they do have anonymous it's called STD check on online, where you can anonymously send somebody a text message and let them know that they've been exposed to an STI. And there's a lot of other websites that you can use, but it's definitely important that you let individuals know, because as I mentioned last night, a lot of people don't know that they have these STIs, and they can risk spreading it to somebody, they can spread it to somebody else, and then they can spread it to somebody who become pregnant, and then now you got a baby involved and all this other stuff. So it's very important that you focus on getting treated and not so much who gave it to you, because at the end of the day, like I said, it's consensual. You laid down there and had sex with them, so again, you have to deal with those consequences. So just make sure that you're taking care of your health, and you're getting you're treated. And then, like I say, also informing those others that they need to go get treatment as well, even if it's anonymously, even if you want to tell somebody else and they tell them, just make sure you tell the folks. I mean, because we have a lot of people that say, well, I want them to find out on their own, like I found out, myself. No, that ain't right. They need to know, because they probably didn't know that they had something.
okay. So Brandy, I like that you say there's an anonymous way that you can do that to let someone know. Is that a website, or is that
Yes, it's a website, and I'll put it in the chat so you can have it, or you could just Google it. They have like you can just put like anonymous notification of where you can tell your partners. And it's so funny because people come in there and say, "Oh, I got this anonymous text or whatever. I need to get tested." I would rather somebody do that and then are aware and think they got something so they can come get tested, rather than not know. So yeah, they got plenty of ways around it where you can anonymously tell somebody. Because like I said, I done had plenty of guys come up in there and tell me, yeah, I got this text and I don't know what comes. I don't know if somebody playing with me or not or whatever. Get tested anyway. What is gonna hurt for you to get tested? So yeah, I'll put them in the chat box, because it's a couple of them where you can actually, put that cell phone number or that email number or email in there, and it actually send an anonymous text. You can click, what you have, like if it was syphilis or, gonorrhea or something of that sort, and it'll send them anonymous text. And you can even test it yourself. So you'll even see, you can test it so you can see how like the text is going to be. So you'll see that it's not going to put your information in there. And actually you're going to be on your phone, and it's a website. So you'll know that it's actually not coming from your, like a text message where it has your phone number on there.
that's that's awesome right there, Brandy. That's awesome. I hope that there are Brandy said something on last night. Talk to your children. about sex, and and I kind of followed up and said, if you don't talk to your children, then someone else is going to talk to them and convince them, not to talk about what happens to them, or when somebody touched them, or when even they have contracted something. Um, so Tabitha says that I have a past, but by the grace of God, I'm still here, and you're not the only one. I have one too, and sometimes I just kind of, I wonder if we're really ready to receive some of the past things that we're going. I'm just going to take a minute right here because I just think this is so fitting. Because I remember back in the early '90s, one of the first HIV cases that hit Palaca, one of the first HIV cases that hit Palaca, a young lady, she passed away. And the guy who gave her HIV, he was my boyfriend. This guy was my boyfriend. Back in the early '90s, late '80s, early '90s, there was not a lot of information regarding HIV, and it was a stigma. Um, I've heard people say that, when people say that they have cancer, people embrace you, but when you say that you have HIV, people push you away. Well, I want to say that nobody willingly goes out and contracts HIV. No one willingly goes out and contracts HIV. But to be so transparent with you is that it was during that time that I thought I had HIV. And shortly after, I moved away to Tallahassee. And for 10 years, I didn't go to the doctor, and I didn't go get tested. And finally, eventually, I wind up down in Reverend Dr. George McRae's ministry, to where his ministry focused on HIV and drug use. And it was through his ministry that I learned so much. I attended so many classes learning about HIV, talking to people who were HIV positive, taking their medication, living a normal life as can be, by eating right, taking their medication, and not being so stressed out. It was at that time, 10 years later, I want to say on or around 2002, that I went to Reverend McRae stood up, the late Reverend Dr. George McRae, who just passed away. Has done a great work down there in Miami, and I'm a recipient of that work. Um, but he stood up one Sunday and he said, "This is why I'm so passionate about what I do." He stood up one Sunday and he said, "Everybody in the church needs to be tested." He said, "Because you need to know your status." He said, "If we're going to do the work of Jesus Christ, if we're going to help people," he said, "you need to know your status. And so, therefore, there's help for you if you are HIV positive." So it was on or around 2002, for the first time in my life, 10 years later, that I went to get tested. And my test was negative. 10 years later, I was negative of HIV. Well, that's a shout and that's a glory, hallelujah. And I was very excited when I left the woman's office. But when I look back over my life, everybody that that young man had been with since me 10 years later either contracted HIV or was dead. Y'all ain't hearing me today. I don't just do stuff because I'm moved by something swinging in the tree. I do stuff because I'm passionate about it. And so when I look back over my life, I should have had HIV. I should be dead and gone. I should be living amongst those, but I'm here only because the grace of God, because God has graced me, and I practice abstinence and celibacy not because I'm so holy, but because I know that if the devil get another opportunity after me, he's going to take my life or allow me to be placed in a position to where my life will be taken. So if you're not convinced by now that you, number one, need to know your status, know that it takes three, and then you need to be informed and in the stigma, I don't know what it's going to take for you. But I'm here by the grace of God. It should have been me. It could have been me. It would have been me if it had not been for the Lord who's on my side. And I'm not embarrassed. I'm not afraid, because anything that the Lord has delivered me from, I don't have a problem sharing that information. And so if there's anybody under the sound of my voice, if you're not convinced by now that you need to know your status, or you need to deal with what is going on with you, or what situation you have been put in, it may not have been your fault. Somebody may not have disclosed their status to you. Maybe you did it willingly and you played Russian roulette. It doesn't matter how you got there. What matters is there's some information that's presented to you that you can take ownership over your life, and you can live a long time with the proper medication, with the proper diet, and alleviate stress out of your life. That's it. It's not that difficult as you want it to be. And so I'm here because I'm so passionate about what I do. Brandon, I'm so passionate about this. I love it because not because you did a wonderful job, but it's because I lived through it. I know the pain, I know the alienation, I know I know how you feel. I know the depression. I know the want to give up. I know the want to quitting. I know the want to throw. I know all of that. And so here we come trying to throw you a lifeline while you're out there trying to drown. Once again, I can't make you take it. Brandy can't make you take it. And it's up to you to take that. Amen. Amen. That's my testimony. That's my shout. That's my glory. Hallelujah. Amen. And so we're going to move forward. I don't mean to steal the show, but I do it when I'm led to do it. And so I think in this atmosphere and what we're talking about, it was very fitting for me to share that with you. And so another question, Brandy, is that since herpes is an incurable STI, and so if a person has it and they get treated, does it lie dormant in your body like cancer, and can it come back again?
Yeah, so great question. Yeah, you're absolutely right. So with herpes, because it is a virus, so it does remain in your body. So it does lay dormant, where you're not having outbreaks. So when that's what you consider as dormant. And there is medications that you can take, so that it can remain dormant, so that it's actually not shedding that virus, so that you're actually passing it to individuals. It can come back from time to time. I know some people that have outbreaks all the time. Then you have some people that never have an outbreak. And then you have some people who have outbreaks once a month. You have people that have outbreaks when they get stressed out. So it just depends on your immune system. If you're taking a medication, like I said, there is a medication, a cyclovir, that you can use, or the common name for it is Valtrex, is one of them that you can use to keep that virus suppressed, so that you're not transmitting the virus and it's not shedding, so that you're spreading it to individuals. So yeah, it lies dormant, and even sometimes you might not be having an outbreak, but it can still not be dormant, and you can be passing that virus on to someone else. So if you have herpes, like I say, they do have medications that can help you manage it, so you won't spread it to individuals. Pretty much same like the HIV medication. So that's what those medications do. It's a virus. It keeps the viral load low, because the lower the viral load, the less virus is in your body, which means that that's a lower chance of you spreading the virus to someone else. Okay, so just kind of think of it like that. So it's a virus, so it kind of works the same way. Good question.
Okay. I think in the comments, I think we got some shouting and some hallelujah. Please know that Brandy did put those um, the websites in the comments regarding anonymous notifications. I mean, that's a great tool. I mean, sometimes you say you don't want to tell people, you don't know what the repercussions will be. I mean, at least you can do it anonymously, and it doesn't hurt anything for them. And at that point, it's for the person to follow it up or not follow it up. And Tina said we all had a past and have been spared of a lot of serious issues by God's grace. Tina, that is, that's my story, and I don't try to pretend that I am who I am because I haven't been through nothing. I try to stand before people and let them know that the only difference between me and you is Jesus Christ. Hey Nettas, thank you for being here. And Tabitha, she's praising the Lord. Thank you so much, Tabitha. Appreciate you. Glory, hallelujah. Okay, so we do have And once again, for those of you who are watching by Facebook Live, do you have any other questions or any other comments? I have a couple more questions, and we'll come almost to the end of our program. So I want to make sure that whatever you have on your mind, whatever you have on your heart, and if my testimony did encourage you to, number one, to be strong and to know that God can do anything but fail. And when you do what you can do through the medical professionals, then God can just step in and do the rest, because God will always meet you to the extremity of your need. Listen, there are some times when you can even contract something that God can heal you, He can deliver you, and He can set you free. So all hope is not gone until God heals you, until He delivers you. Then go ahead and take care, of yourself. And so another question is, Brandy, is I know you said to beware of the H. Everything begins with the H, the hepatitis B and the hepatitis A, I think. But can hepatitis C be transmitted through sexual contact?
Um, It can, but it's a really low chance. That's one of those ones that is mostly transmitted through sharing needles. So when you're getting tattoos, that's when you want to make sure that you're not going to old boy on the street, that's giving tattoos. And if you are, just making sure that they're using clean needles, that they're cleaning their needles, that they're sterilizing their needles, and basically you should just go to a shop, because if you go to a tattoo shop, they are under certain guidelines where they can't use like the same needles, and they're under certain requirements because of hepatitis C. So it can, but it's highly unlikely. Like I say, most of the time I see individuals that have hepatitis C is from like sharing needles. I mean, even if you have diabetes and you have some people that are poor, and they can't afford those needles, and sometimes they're sharing and things of that sort. The whole racism and social economic status is like a whole nother issue, when it comes to Black people and access to care and all that. But yeah, it's mostly through sharing needles and things of that sort. Hepatitis C. Hep B is mainly the one that is sexually transmitted.
Okay, and if we don't have any other questions, I have one more question, and then I'm gonna let Brandon, just kind of summarize it up, and thank each and every one of you for being here and joining. I hope that you have been helped. I hope that you will share and care some of the information. So one of the last questions that I have, Brandy, is where do you obtain the female condoms from?
And like I said, I can only speak for Arkansas, but you can't. So I know you can order them. Some health departments have them. I know we can't really purchase them for some odd reason. The health department like I said, when I can only speak for my health department because they're real particular about things that we purchase. I mean, I work for the state, but you have some community-based organizations that have them. So you can look up, community-based organizations that do like HIV testing. You can just Google that in Florida. There's a plethora of community-based organizations in Florida or other states, Georgia, or that have those community-based organizations that sell, not sell them, but they provide female condoms. And then, like I say, you can order them. I've seen them in a couple of stores here and there, not too many, because they are kind of expensive. And yeah, so you'll just have to look around for those. They're not as readily available as the male condoms are, because I will say one thing about the female condoms. It's a bit much, it's it's not as simple as like the male condom, because it's like a ring inside of it. You actually have to put the ring a certain way and place it in your vagina, almost like the Nuva ring, a little bit. And you have to make sure that it's correctly. I know I hear some women, they'll say like it's very noisy, because it's made out of polyurethane. It's not like latex like your male condom. So sometimes they say it can be like really loud, and but You rather something be loud than be around here with a baby or a STI. So yeah, so you'll just have to like look for those. But I know most of your CBOs or community-based organizations that do like STD prevention, they typically have those available because they can get them, cheaper and with grant funds and things of that sort.
Okay, Miss Brandy, is there anything else you would like to say? My battery is running low. Hold on just a minute. Let me plug up.
I was about to say, I don't know that that noise. So one thing that I did just want to mention just quickly, and Chiquita, and I know you don't ran off the screen, but I wanted to, to just
Go here,
I
go.
know, yeah, I just want to touch. I know, I just want to touch on it because I know one of the common things, especially in the Black community, is about like these 10 years, before HIV show up, and then you'll be having all these symptoms and this and that. HIV, once you contract HIV, it just depends on your immune system. We have some individuals that, and within like a month, they advance to AIDS and they end up getting very sick. And then you have like some younger, especially like younger adults, are healthy, immune system, they won't have any symptoms at all and won't know that they have it. So that's a myth when they say, oh, your signs and symptoms gonna show up in 10 years. And, if I had some, it'll be, you'll experience something. Eventually you may, if you have it for so long, because you do need to be on some type of medication to keep it, virally suppressed. But you have some people that just have a good immune system, or, or I don't know what they're doing, taking their emergency or something, to where it's actually keeping the virus suppressed. So if you think you're infected, or, you think you've been exposed or something, the only thing you can do is just go get tested. Recommend once a year. If you are, have more partners, or you think you're more at risk, you can go get tested more regularly. But at least at minimum once a year, you should be getting tested for STIs. I mean, even if you married, I'm gonna put that in there. Even if you married, even if you think you're in a monogamous relationship, you should still be getting tested. And if your partner got a problem with it, take him up there and get tested as well. Because my thing is, this is about your health, not theirs. And my thing is, if they know they ain't doing nothing, they should have a problem with you going up there to get tested anyway. And they shouldn't have a problem going up there getting tested anyway. I know I hear that all the time, where partners be getting mad because the person went and got tested for STI. If you ain't doing nothing, why does it matter? you know, just like, with babies, if that's the only person that you've been with, that's your baby daddy, so, just go get tested once a year. And like I say, more regular if you feel that you need to go. And definitely if you're having any signs and symptoms, you should definitely go up there and get tested.
There you have it. That is the best solution to each and every one of our problems. Know your status. Just know your status. It doesn't matter who you're with. Just know your status. And once you know your status, then you can govern yourself accordingly after that. No one's telling you how to proceed or how not to proceed, but just know your status. Because I can assure you that you would want to know what's going on with yourself, and then you don't want to wait to the last minute and then it has, expedited to something else. So, once again, I'll say it: know your status, be informed, and just remember that it takes three. And I learned that from Miss Brandi.
Exactly. And also, I just want to add that I'm always available. I mean, if you want to contact me, you can definitely reach me on Facebook. I do read my message, or my email is brandy.roberts@arkansas.gov. Or you can find any Passmore or my mama or Roberts or anybody in Palaca that knows me, that has my information. So definitely do not feel like you can't reach out. So I am a medical, in the state government, and I am bound by HIPAA. So if there is any information that you tell me, I cannot share that information with anybody else. I know we talked about that earlier where, other people aren't bound by HIPAA, but I am bound by HIPAA, and I don't want nobody knowing your information anyway. That's not my goal. That's not the purpose of me. You first of all, you telling me, but I'm trying to help you and then also help others. So definitely, if you need me to talk to your kids, you need me, and then I know when I come home, I do bring condoms. Definitely hit me up, or I can mail you some. So yeah, if you have any other questions after that, please do feel free to hit me up in Messenger. Don't put it on my main page now. I had some folks be asking me some questions like, don't be doing it on my main page now. People know what I do at work. So thank y'all for having me. I was glad to be able to offer, something that I do every day, that I, experience every day as working, with different individuals who are infected and also affected by this, because just because you don't have an STD or you're infected by an STD, you're affected by it as well, because you may have others that, you can share this information with. You may have others in your family who may be, living with this, don't want to tell anybody, don't know where to turn, don't know what to do. So definitely it's good that y'all are here, that you're hearing this information. The internet has a lot of information. Make sure you're just going to a credible source, like Google. Make sure that it's like from CDC or Planned Parenthood or some of those other sites where it's credible information. Yeah, just don't because I know Facebook, they be coming up with these ads and stuff with these condoms that turn colors and all that stuff. That stuff don't work. Use your regular condom. And even like with condoms, I know people have their preferences and say, some of them pop and all that other stuff. The thing is, they popping because you're not using them correctly. So make sure that you're putting them on correctly. And like I said, don't get ones that's too big, because it defeats the purpose of you having it on. So again, y'all have any questions, definitely feel free to reach out. Thank y'all.
So there you have it. Thank you for each and every one of you who have joined by Facebook Live, who supports Brandi and who supports myself. May God richly bless you and encourage you through this thing that we call life. This will end our broadcast on tonight. Brandi has been with us for 2 days, and she has poured out some very vital, essential, and important information. My prayer is that you take that information, you'll pray over that information, and you'll utilize what you need. You don't need all of it, just chew the meat and spit out the bones. Or whatever you need, just take out of it and use it to the best of your ability to help you and your family members have a better quality of life. So that's going to be it for me. I don't think I have any more comments. Um, just a lot of glory, hallelujahs, and great information. Great job, Brandi. Thank you so much, Tina. You have much to be proud of, and hopefully we'll be seeing more from Miss Brandi. Hopefully, I know at least from my perspective, we will do this at least annually. And if anything else should come up that I can greatly benefit to the community, I will certainly reach out to Brandi. Okay, so Tina. Proud mom. Okay, I'm going to sign off, Brandi. I love you. Thank you so much. You're great. Continue to do what you do. This is going to end our broadcast from Pastor Jaquita Williams. I love you and God bless you is my prayer.